Have you seen that there's an ability to access more providers as a business using virtual care? Do you feel like that's been easier to recruit providers, onboard them, retain them in your model using more virtual rather than in-office care?
Yeah, I mean, I think virtual care is now a staple of mental health treatment. I don't think we're going back completely. I think it'll always have an important place. Like you said, Danielle, choice is extremely important. No one is proposing that virtual care should take the place of in-person visits, and those in-person visits will be so important for a lot of patients. But providers also, they want to do virtual or hybrid care. They want that to be part of their repertoire. And so if you're not offering virtual care models to providers, you're not going to attract many providers. You'll really limit yourself. And to your point, Danielle, there are such a vast variety and diversity of clinicians that you're not going to find in a hospital-based clinic or at the closest PCP's office. And yeah, you can reach them better over the www.
I love the question because we were focusing a lot on the patients and the choice of the patients, but this also from a telehealth versus hybrid versus fully in clinic, it levels the playing field for clinicians as well, right? And I think, when you start to add in technology to improve the human care elements, for relieving some administrative burden, for adding in more standardization and improved quality, you're also upskilling clinicians and giving them an equal opportunity to really deliver care in a meaningful way that has not been widely accepted for a long time, and you're doing so in a way that feels much more responsible. I think, that also is something that I just wanted to think about, and if you have any thoughts on.
No, I love that, especially as a nurse, because I think, nurses, we start out at the bedside, which is so inherently physical, and sometimes we get cut off from advances in health tech. We're not aware, when I was an RN, I mean, we were not harnessing technology to its full potential. I did not interface at that time with AI, with telehealth. There was a few exceptions, interpreting services and other technologies that we used. But yeah, RNs get really cut off from it. And then as they become advanced practice registered nurses, I think they fall behind a little bit. It should become a competency. It's something that confers advantage for that provider and helps them expand their clinical scope.
Yeah. What are some of the key technology or strategies that you've seen to help make virtual care more possible and more feasible, more accessible for patients and clinicians?
Yeah, so I mean, technology helps so much with measurement-based care, getting data in between visits, communication. Our patients have so many different ways that they can communicate with us, and before that would be almost dangerous if you have too many lines open, they're not all monitored. Well, now we can monitor all the lines. The patient can decide how they want to communicate with us, whether that's by text, if it's the chat portal in the EHR, if it's by telephone. And because of technological advances, we can see all of that at a glance using APIs and other technology.
Beyond the care coordination, which I think is really important, is also this ability to look at a person more holistically using different endpoints and different, you'd mentioned, you touched upon measurement-based care, but to dig into that, or double click if we would, on that.
Circle back.
I do think there's something around when we think about measuring quality, when we think about standardization, when we think about the ways that we can pull technology into these different places, what's your thinking on what you're using today, and then what will you see using in the future, like on that same vein?
Yeah, that's so interesting because with care pathways that are enabled with technology, there's this sort of tension. You want to have a really simplified, standardized care journey, right? You want it to be as automatable as possible, as clear to follow. That's not the case. Patients are different. They have unique needs. And it's part of our responsibility to be able to address those unique needs. So I think that with AI and tech advancements and virtual care, that we're just going to be able to refine. So we will have these care journeys that are really standardized and based in best practice, but then we will also have this amazing clinician subjectivity that is really guided and co-piloted by technology, but preserves the ability to have really personalized care journeys for patients. And with adoption of technology in mental health, I think that is so important, really being able to preserve clinician judgment and figuring out, when are we using this AI in a way that is not just AI, technology in general, when are we using this in a way that helps the clinician and cuts down on admin burden, versus when are we like overstepping and where this should be in the hands of a clinician. So I think it'll just, the co-piloting with technology will be really, really beneficial.
I love that concept of co-piloting, because I do think there's a little bit of fear in the clinician world that technology might overstep, as you said, like getting, you go through the education you need to be a clinician and to treat patients in order to treat them to their unique needs. Mm-hmm. And also balancing it with the advances and the need for us to have support as clinicians to be able to make informed decisions as we're dealing with the burden of more patients with more needs, with more demands. And we know that the clinician shortage is a very real thing. So I love that idea of a co-pilot, of a balance to help support the decisions you're making, but allow you to still use your education and your expertise as a clinician to make the most informed decision for your patient. I love that aspect of it, to be able to allow.
And clinicians need to be really involved now and give their input into technology and how we're using it in mental health care to validate it, really.
Yeah, absolutely.
I think that's one of the things at Qbtech that I've enjoyed so much about our experience, is being able to take that clinician feedback in real time and give it some nuance when it comes to what are the implications in clinical practice, what is the patient experience looking like, and how do we adapt our products in the way that people experience our products in a way that is really meaningful, that allows for clinicians to use their time wisely, the ways in which they feel that is the best and most advantageous, so that we can think about the working at the top of your license, or however we want to phrase that, right? So you're really using things in a way that's meaningful, that is stayable as well, right?